My laptop is locked. It just came on because of the iPad hitting it. And it's just here because I can set my iPad on it so you can see me. Alright, so first what I'm going to do is grab my order form and the hospital policy. I'm going to verify both of them. Okay, I'm going to wash my hands. Hey, Mr. Jones, how are you? Alright, Mr. Jones, I'm going to go ahead and do your NG tube, okay? So I'm just going to go ahead and check the order and your armband. So it's Mr. Jaguar J. Jones, Mr. Jaguar J. Jones. Date of birth, 8/25/1963. Date of birth, 8/25/1963. Allergic to penicillin, allergic to penicillin. Is there anything else you're allergic to, Mr. Jones? Alright, so now that I've done that, I'm just going to go ahead and get my supplies ready, put my goggles on, have my tape ready, get all my supplies that I need, okay? Alright, so Mr. Jones, what I'm going to go ahead and do now is wash my hands, raise the bed up to working level, lower the side rails. Okay, I'm going to go ahead and assess for your vital signs, put the pulse oximeter on. I'm going to listen to your bowel sounds, okay? Alright, so now I'm just going to raise the head to high Fowler's. And at any time during this procedure, your oxygen saturation or your vital signs were to decrease, we would stop the procedure, I would pull back the NG tube into the nasopharynx, and we'd let you catch your breath and go back in, okay? And I'm going to go ahead and we're going to establish a cueing sign, so if you wave your hands at me, we would pull back the NG tube, we would wait for you to catch your breath, and we would go back and proceed with the procedure, okay? Alright, so now that the head of the bed is raised, we're just going to go ahead and I'm going to open up my NG tube. I'm going to put some lubricant on the NG tube. Not the NG tube. I put it on the wrapper of the NG tube. I open up my syringe. I would loosen it up. I'm going to go ahead and place my my gloves on. Alright, so Mr. Jones, what I'm going to get you to do is close one nostril for me and sniff. Alright, and do the other nostril for me. Perfect. So what we're going to do, we're going to go into the left nostril. I'm going to go ahead and place this towel over your chest. I'm going to put the basin on your, not your chest, on your abdomen. I'm going to place the basin on your abdomen as well, okay? So, now I'm just going to go ahead and wipe your nose with an alcohol pad or soap and water. I'm going to pat dry, okay? And so now, I've done that. I would normally go ahead and measure from your nose to your ear to the xiphoid process, but I did that in another video. And so now I'm just going to go ahead. My dog ear tape is on my NG tube, and I'm just going to go ahead and pull the NG tube up. Just going to wrap it in my hand. We're going to lubricate the first 4 inches of the NG tube. Alright, and so Mr. Jones, I'm going to get you to lean your head back, okay? And I'm going to enter the NG tube 1 to 2 inches into your nostril, okay? We're going to go in and we're going to turn at 180 degrees, okay? So at any time during this procedure you were to show any signs of respiratory distress or any signs of your oxygen saturation would decrease, or your vital signs, we would stop, pull back into the nasopharynx, and we would return. So now that I've reached the back of the nasopharynx, I'm going to get you to lean your head forward and take a sip of water every few seconds, or dry swallow, whichever one is indicated. And we're going to continue, okay? Every time you swallow, I'm going to advance a little more until we get to our marker, all right? Mr. Jones, you're still doing okay? Perfect. All right. We're almost there, okay? Alright, so now that we've reached our marker, I'm just going to go ahead and get a piece of tape, and we're just going to secure it to your cheek temporarily, okay? Alright, so now that I've done that, I'm just going to look in the back of your throat for placement. I'm going to look with my pen light tongue depressor. Alright. And I'm going to take my syringe and I'm going to aspirate for any gastric content. And if indicated, I would go ahead and test the pH level of that. And if it was ordered, I'd go get the x-ray and see if the placement was correct, okay? Alright, so now that I've done that, I'm going to go ahead and take this dog tag off. I'm going to place a marking on the end of the NG tube with a marker, so if any dislodgement or anything happens like that, we would know. I'd go ahead and get the skin prep and prep the bridge of your nose, prep your nose. I'm going to go ahead and grab this other piece of tape. I'm going to secure this one side of the tape to your nose, the middle let it float, and have the other end to the NG tube and let it float, the NG tube floating. I'm going to take this other piece of tape off, and I'm going to clip this, clip it to your gown to secure it, and so you can turn your head from either side, and following the hospital policy, I'd go ahead and, if it was ordered, do suctioning and low intermittent wall suctioning. I'd hook it up here, but if not indicated, I would go ahead and connect it back to itself. Make sure the blue pigtail is above your abdomen. I'm just going to place it right up here on the top of the bed, okay? So, I have done all of that. I'm just going to go ahead and clean up my area, alright? Throw everything away. Move all of this out your way. I'd lower the bed. I'd raise up the side rails. I wouldn't move I wouldn't move the head, like lower the head back to lower than 100. I wouldn't lower the head back to less than 30. So you're always going to be above 30, okay? Whatever's comfortable for you, but no less than 30. Alright, I'd take my gloves off or perform hand hygiene, and I'd go and document, okay? I document the size and type of the NG tube, which nostril I inserted the NG tube into, how I verified the placement, how I secured the NG tube, if there was any suctioning, if any amount or type of secretion, how you reacted to it as well. I go and document all of that, okay? Alright, and so for discontinuing the NG tube, I would go ahead and grab my order, verify my order, check the name, Mr. Jaguar J. Jones, Mr. Jaguar J. Jones, date of birth 8/25/1963, Date birth 8/25/1963. Allergies penicillin. Allergies penicillin. Wash my hands. Put my gloves on. I would place this right over here. I'd raise the bed up. I put it on your abdomen. Place the basin on your abdomen on top of the towel as well. Raise the bed up to working height. I'd turn off the suctioning. Alright, Mr. Jones, so I'm going to go ahead and take off the tape. Okay. Alright. And now I'm just going to go ahead and start kinking the tubing back up onto itself. And I'm going to get you to take a deep breath before I start taking it out and hold it, okay? I'm going to try to go as fast as I can, okay? Kinking it back up onto itself. And I'd go ahead and throw all of that away. I would be measuring for any types of secretions, the type and the amount and the consistency and the color. I'd perform oral care, and I'd make sure all the clean you up, make sure your call light and any personal belongings were next to you. I'd clean up everything, throw it all away, and I would go and document. Do you have anything else you need to say? Or anything else, Mr. Jones? Alright, so I'd take my gloves off, throw it away, wash my hands, and I'd go and document.